share with everybody what your experience has been with PDGF, and are you concerned at all about what PDGF is doing? Do you feel there are any negatives?
No, so I mean, it just real quick, what kind of Shannon said with my patients, they're getting the biggest bang for their buck by doing these combination procedures with having that application of PDGF, exosomes, PRP, cutting down that healing time. So they're getting a combo treatment that's super effective, but also maybe having less healing than they typically would if they were just doing the CO2, which is best of both worlds. I haven't had any downsides with PDGF. I love the topical application for it. I think the injection of PDGF is something up and coming and maybe we need to be cautious with, but I don't see many downsides with that as long as you're doing it the correct way and safely. But again, most importantly, you need to make sure your patients are aware, consented, and you're going over things with them.
Yeah.
Well, what I do is, luxury skincare with medical skincare.
Yeah.
So, it's beyond the fluff.
Beyond the fluff.
If someone
like
comes
that.
in, they're complaining about fine lines,
Yeah.
preventative, fine lines around their eyes. What can I do besides just microneedling just to, help with hyperpigmentation,
Yeah.
help with, just an overall rejuvenation.
Well, you've got over 20 years of experience. Do you feel that this has given you
That next step?
Next tool.
Oh, yeah.
So you're
Next level.
You're bridging between what you've always been able to do and what Julie can do.
Yeah.
I love it. The last part that I'd just like to add, I feel very strongly, and I know you guys agree with me, that Nanofat is the preeminent. That's the top of the aesthetic ladder. You're bringing in stem cells, you're bringing in extracellular matrix proteins, and you're bringing in lipid droplets, which are exosomes to the 10th degree. But I think that what's fascinating is how Ariessence has been able to deliver recombinant PDGF. And you and I have talked about this recently, where this is supercharged PDGF very safely, meaning it's recombinant, it's created in the laboratory, same way that a filler is created in a very sterile environment, the same way that a neurotoxin is created. So it's a very safe product, and it's just supercharged. And by being able to deliver this product and taking it and comparing it head-to-head with Nanofat, we've just wrapped up a clinical trial, which is very impressive. Stand by, the results are coming. They'll be published very soon. Number one, safe. Number two, the results are incredibly close to Nanofat, which, of course, makes me a little bit disappointed because I'd like to think that Nanofat was the premier, and it is. When you look at the pathology slides, there is a definite difference. So as we follow this out to 1 to 2 years, because we're really only at 6 months follow-up right now, we will continue to see differences. But at this stage, clinically, because we did a split face, and the patients were blinded. They didn't know which side we did, and the patients couldn't tell. And then we had blinded observers. Obviously, I had to know because I was doing it. But we had blinded observers, and they couldn't tell the difference. So what does that mean about PDGF? I think it means that it's a great product, and we're looking towards many new applications. You mentioned one of them, and that is injecting, and that is a new frontier, and that is a whole new area. But this is being applied topically. Is certainly well within the FDA's realm of acceptable treatments today,
Yeah.
and it's really, really exciting.
It is.
So for you, from the perspective of an esthetician, what does PDGF mean to you?
It's safer.
Yeah?
A lot of people don't feel that comfortable with exosomes.
Interesting.
So it's another option, and it's a lot safer than PRP, blood withdrawing.
Well, Shannon on her own or estheticians on their own,
I can't draw blood.
she can't draw blood. So if she's here by herself, Dr. Claytor and I are both on vacation, which never happens.
Never
but
happens.
if we are, and no one's here to draw blood for her or whatever, she can just grab the PDGF, which is predictable, not patient dependent, so that's a great option for you.
Yeah. And applying it topically is widely accepted, and combining it as a rescue following CO2 lasering and microneedling, I think what we're looking at is combination treatments creating that perfect sweet spot, and really pretty much everyone has microneedling. Most most advanced centers have a CO2 laser. So this is something that pretty much everybody could be doing tomorrow.
Right. Or they can just send them to us.
Or they can send them here. I love that. That's
Yes.
so great. All right. Well, we love teaching, and you guys are all great for tuning in. Thanks so much.